Hey, Dr. Birchler from the Chiropractic Health Center. One question we get asked a fair amount when we're dealing with people with low back problems, especially if they have been told they have, I think they have a disc problem or things like that, is they say, well, does a disc bulge show up on an X-ray? And the short answer to that is no, it doesn't. And I'm going to show you an example here to illustrate that. So this is an X-ray of a recent patient in the office, and this person's roughly 40 years old. So just in terms of the spine and the amount of wear and tear and things like that, and you see these square-looking things with the bones, and then the disc would be the space in here, but you're not actually seeing the disc. You're not seeing a space that represents how thick the disc is, but you can't actually see the disc itself. And so if you looked at here, you'd kind of see how thick the disc is and whatnot, but you're not really seeing a disc, you're seeing a space. And this person clearly had a disc injury, so we ordered an MRI. And if you look at the MRI, you see the discs in here, and then if you get to the bottom disc, there's this part that's herniated out the back. This is called a disc herniation, and but not visible on an X-ray. So to properly diagnose a person who's having commonly leg pain, sciatica, things like that, or back pain that might just not be getting better. Maybe they're trying to stretch, or maybe they're getting adjusted, or things like that with chiropractic, but something is not getting better. Commonly that's because there's something more intensive going on, most common thing being a disc type of problem. So hopefully this helps understand, no, you can't see a disc herniation or bulge on an X-ray. You need an MRI for that. And if you're having trouble with this kind of thing or need some evaluation, we can certainly give you guidance on that and do our best to help you.